Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The plan of care for an outpatient client with chronic undifferentiated schizophrenia includes risperidone therapy. The nurse prepares to administer this drug based on the understanding of which of the following? 1. The positive symptoms of CUS are usually more prominent than the negative symptoms. 2. Agranulocytosis is less of a risk with risperidone therapy than with clozapine. 3. Traditional antipsychotics help with negative symptoms, but not as well as Risperdal does. 4. Risperidone is less expensive than traditional antipsychotics. The correct answer is 2. With CUS, negative symptoms are more prominent. Therefore, risperidone is given to help control negative symptoms. Negative symptoms do not respond to traditional antipsychotics, such as Haldol or Thorazine. Agranulocytosis is commonly associated with clozapine. Because it is a newer drug, risperidone usually is more expensive than traditional antipsychotics. The nurse is planning care for a group of pregnant clients. Which of the following clients should be referred to a healthcare provider immediately? 1. A woman who is at 10 weeks gestation, is having nausea and vomiting, and has +1 ketones in her urine. 2. A woman who is at 37 weeks gestation and has insulin-dependent diabetes, experiencing 2 to 3 hyperglycemic episodes weekly. 3. A woman at 32 weeks gestation and is preeclamptic with +3 proteinuria. 4. A woman at 15 weeks gestation who reports she has not felt fetal movement. The correct answer is 3. The nurse should refer the preeclamptic client with 3+ proteinuria to a healthcare provider. The 3+ urine is significant, indicating there is much protein circulating. The woman who is 37 weeks gestation with insulin-dependent diabetes who has experienced hypoglycemic episodes in the past week can be managed with food and glucose tablets until the client can obtain an appointment with the care provider. The client at 10 weeks gestation with nausea and vomiting and +1 ketones should also be seen by a healthcare provider. But at this point, this client is uncomfortable, but her life is not in danger. The 15-week client would not be expected to feel her baby move this soon in pregnancy, and this would not be considered a problem that requires immediate referral to a healthcare provider. The nurse is working with 4 clients on the obstetrical unit. Which client will be the highest priority for a cesarean section? 1. Client at 40 weeks gestation, whose fetus weighs 8 pounds by ultrasound estimate. 2. Client at 37 weeks gestation with fetus in right occiput posterior position. 3. Client at 32 weeks gestation with fetus in breech position. 4. Client at 38 weeks gestation with active herpes lesions. The correct answer is 4. Herpes simplex virus can be transmitted to the infant during a vaginal birth. The neonatal effects of herpes are severe enough that a cesarean birth is warranted if active lesions, primary or secondary, are present. A client with a primary infection during pregnancy sheds the virus for up to 3 months after the lesion has healed. The client carrying an infant weighing 8 pounds will be given a trial of labor before cesarean. The client with a fetus in the right occiput posterior position will have a slow labor with increased back pain, but can give birth vaginally. The fetus in a breech position still has many weeks to change positions before being at term. At 7 months gestation, the breech position is not a concern. The nurse is preparing to administer furosemide, Lasix, to a 3-year-old with a heart defect. The nurse verifies the child's identity by checking the armband and 1. Asking the child to state her name. 2. Checking the room number. 3. Asking the child to tell her birth date. 4. Asking the parent the child's name. The correct answer is 4. Safety standards require the use of 2 identifiers prior to medication administration. A parent can be used as the second identifier. Many young children will only answer to a nickname that does not coincide with a medical identification band, or may answer to any name. It is common for children on a pediatric floor to go into each other's rooms. A small child may not know their birth date. After teaching a child with leukemia scheduled for a bone marrow aspiration about the procedure, the nurse determines that the teaching has been successful when the child identifies which of the following as the site for the aspiration? 1. Right lateral side of the right wrist. 2. Middle of the chest. 3. Distal end of the thigh. 4. Back of the hip bone. The correct answer is 4. Although bone marrow specimens may be obtained from various sites, the most commonly used site in children is the posterior iliac crest, the back of the hip bone. This area is close to the body's surface but removed from vital organs. The area is large, so specimens can easily be obtained. For infants, the proximal tibia and the posterior iliac crest are used. The middle of the chest or sternum is the usual site for bone marrow aspiration in an adult. The wrist, chest, and thigh are not sites from which to obtain bone marrow specimens. The physician has inserted a chest tube in a client with a pneumothorax. The nurse should evaluate the effectiveness of the chest tube. 1. For administration of oxygen. 2. To promote formation of lung scar tissue. 3. To insert antibiotics into the pleural space. 4. To remove air and fluid. The correct answer is 4. A chest tube is inserted to re-expand the lung and remove air and fluid. Oxygen is not administered through a chest tube. Chest tubes are not inserted to promote scar tissue formation. Antibiotics are not used to treat a pneumothorax. A nurse should interpret which of the following as an early sign of a tension pneumothorax in a client with chest trauma? 1. Diminished bilateral breath sounds. 2. Muffled heart sounds. 3. Respiratory distress. 4. Tracheal deviation. The correct answer is 3. Respiratory distress or arrest is a universal finding of a tension pneumothorax. Unilateral, diminished, or absent breath sounds is a common finding. Tracheal deviation is an inconsistent and late finding. Muffled heart sounds are suggestive of pericardial tamponade. Following a thoracotomy, the client has severe pain. Which of the following strategies for pain management will be most effective for this client? 1. Repositioning the client immediately after administering pain medication. 2. Reassessing the client 30 minutes after administering pain medication. 3. Verbally reassuring the client after administering pain medication. 4. Readjusting the pain medication dosage as needed according to the client's condition. The correct answer is 2. It is essential that the nurse evaluate the effects of pain medication after the medication has had time to act. Reassessment is necessary to determine the effectiveness of the pain management plan. Although it is prudent to check for discomfort-related positioning when assessing the client's pain, repositioning the client immediately after administering pain medication is not necessary. Verbally reassuring the client after administering pain medication may be useful to help instill confidence in the treatment plan. However, it is not as important as evaluating the effectiveness of the medication. Readjusting the pain medication dosage as needed according to the client's condition is essential, but the effectiveness of the medication must be evaluated first. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about this situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. A client with undifferentiated schizophrenia tells a nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who has preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. 4. A client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy. The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asked the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy. The nurse is transferring a child who has had open heart surgery from the intensive care unit to the pediatric unit. The child's blood pressure has been fluctuating, but has been stable during the last 2 hours. The nurse from the pediatric intensive care unit should include which of the following information in the report to the nurse on the pediatric unit? Select all that apply. 1. Medications being used. 2. Current vital signs. 3. Potential for blood pressure to drop. 4. Drip rate for the intravenous infusion. 5. Time of the most recent dose of pain medication. 6. Medications given during surgery. The correct answers are 1, 2, 3, 4, and 5. The report made when nurses are handing off a client from one nursing unit to another must include information about the condition of the client, potential for changes in client's condition, current medications, and care and services received. It is not necessary to know what medications were given in surgery to provide safe care at this point. Which of the following medication prescriptions to help relieve discomfort in a child with leukemia should the nurse question? 1. Hydromorphone. 2. Acetaminophen with codeine. 3. Ibuprofen. 4. Acetaminophen with hydrocodone. The correct answer is 3. Ibuprofen prolongs bleeding time and is contraindicated in clients with leukemia. Non-narcotic drugs other than ibuprofen or aspirin, such as acetaminophen, may be prescribed to control pain and may be used in combination with codeine or hydrocodone if pain is more severe. Hydromorphone may also be used for severe pain.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.